How reliable are the home-based fetal Doppler devices for checking fetal heart rate?
Hello and welcome. Today, we are diving into a topic that is of great interest to expectant parents all around the world. The question on everyone's mind: how reliable are home-based fetal Doppler devices for checking the fetal heart rate? Stick around as we delve into the world of fetal health monitoring right from the comfort of your own home.
What is a fetal Doppler device?
A fetal Doppler device is a handheld ultrasound transducer used to detect and monitor the fetal heart rate, FHR. These devices work by sending out high-frequency sound waves that penetrate the body and reflect off body structures. The returned echoes are processed to produce a representation of the fetal heartbeat, typically in the form of sound.
How reliable are home-based fetal Doppler devices?
Here's where things get a bit tricky. Home-based fetal Doppler devices can give you a general understanding of your baby's heart rate. However, it's crucial to understand that these devices have their limitations. 1. Skill and experience required. The accuracy of a fetal Doppler heavily depends on the correct positioning and angle of the device. Without professional training, it may be challenging to find the baby's heartbeat. This could lead to unnecessary worry if a heartbeat isn't immediately detected, or false reassurance if a parent mistakes their own heartbeat or other bodily sounds for the baby's heartbeat. 2. Quality of device. The quality of home-based Doppler devices varies. While some may be of high quality, others might not be as reliable. The FDA, Food and Drug Administration, advises against the use of over-the-counter Doppler devices, as they may not meet their safety and effectiveness standards. 3. Interpretation of results. Medical professionals use Doppler devices in combination with their knowledge and experience to interpret the results correctly. As a layperson, it might be difficult to understand if the heart rate is within a healthy range or if there are any irregularities. So, while these devices can provide some level of reassurance and help deepen the bond between parents and the unborn child, it's important not to solely rely on them for monitoring fetal health.
When to use a home-based fetal Doppler?
If you choose to use a home-based Doppler device, it should never replace regular prenatal care or professional medical advice. These devices are best used from the 12th week of pregnancy, when the baby's heartbeat becomes easier to detect. However, if you ever feel concerned about your baby's movement or heart rate, it is crucial to contact your healthcare provider immediately instead of trying to self-diagnose with a Doppler device. In conclusion, home-based fetal Doppler devices can be a fun and exciting way for expectant parents to feel closer to their unborn baby. However, it's crucial to understand their limitations and not to replace regular prenatal care or professional medical advice with their use. Always consult your healthcare provider if you have any concerns. Thank you for watching, and we hope this video has been informative and helpful.